we've talked about the resurgence of polio just being one symptom of Syria's devastated healthcare system. My next guest is Dr. Zaher Sahlul, and he knows all too well the situation. He's president of the Syrian American Medical Society. He regularly travels into his homeland to assess and assist the injured and the dying, and he's also a former classmate of Bashar Assad. They were at medical school in Damascus together. Bashar was an ophthalmologist before becoming Syria's president. Dr. Sahlul, thank you very much for joining me from Chicago, where you are right now. Let me first ask you about polio. We all thought it had been eradicated. What is the real impact, the effect, the severity in Syria right now?
What we are seeing right now in Syria is the tip of the iceberg. When we have 46 cases of polio, that means there's at least 5,000 children who are infected with the virus, carrying the virus and spreading it, and they're not diagnosed. Not every child who's infected with the virus will have paralysis. So what we're seeing really are small minorities of the children who have the virus of polio. And as we all know, polio is not treatable. It's very infectious, and it does not abide by boundaries and by borders.
Will this vaccination program now control it, or are we going to see more? This iceberg that you're talking about, the lower parts of the iceberg going to manifest itself?
That's what everyone is expecting. Unfortunately, the World Health Organization and the UNICEF do not have presence in large territories of Syria. About 50% of the Syrian territories do not have access. NGOs do not have access to them. So I'm really doubtful that we have an effective vaccination campaign in areas like Aleppo, Idlib, Deir ez-Zor, where you have majority of the cases of polio. These areas are only accessible by Turkey or by Jordan.
Well, presumably they could do some vaccinating if they so chose. But let me ask you about the malnutrition. We saw these horrendous pictures of very, very skinny, malnourished children. What is the extent of that problem in Syria right now?
It is a huge problem. We have, according to the United Nations, 2.9 million Syrians who are trapped, who are under siege by the government, unfortunately. We had several cases of children who died in malnutrition in areas around Damascus. These are the same area that received chemical weapons. These are the same areas that the chemical weapon inspectors are going into to inspect chemical weapons. But NGOs like ICRC and Syrian Red Crescent are not able to access, to bring food, baby formulas, and other medical supplies. It is really a shame on the world that we have children dying in malnutrition near Damascus.
And you heard the doctor on the government side of the lines talking about, the threats to medical establishments, that a lot of them are being, attacked and hit by the bombardments. That is probably happening. But what about the situation in the rebel-controlled area as well? I've heard you say that they are deliberately targeted, that the very medical services themselves are a deliberate target.
Oh, definitely. This is something that we've been witnessing from day one in this crisis. And before talking about Geneva II, I think we need to talk about Geneva I Convention that happened in the 19th century, where the international community agreed that hospitals and medical personnel, doctors and nurses and ambulances should not be targeted. And what we are seeing in Syria, and I was in Aleppo and I was in northern Latakia, and some of the hospitals I visited were bombed next week. So we have doctors being killed, we have nurses being killed, we have hospitals being destroyed, and this is a travesty. And it looks like the international community are not really caring about what's happening to doctors, to patients, to hospitals. And this is really very painful to us, physicians from the United States who are trying to provide help and assistance to our colleague in Syria. And we know them, and some of them are dying because of the aerial bombing, because of the ballistic missiles.
We do have some pictures, your own pictures of the hospital in Latakia that you were dealing with, that you say has now been attacked. But I want to ask you, as we're looking at these pictures, to tell me about what you know of Bashar Assad. It does seem incredible that the two of you were classmates at medical school in Damascus all those years ago.
Well, I mean, there's always the different side for, I would say, the dictators. I always wonder what would be the classmates of Hitler or Karadzic or Milosevic have in mind about the other dictators. But, when he was in medical school, he was a humble person. He was accessible. I had a couple of meetings with him after he became a president, and he tended to talk a lot. I mean, he was very humble, and he mentioned one time that he preferred to be a physician. It's interesting to say that, I mean, I heard some of his speeches and interviews, and he always uses medical terminology to describe what's happening. So his first speech, for example, when he talked about the demonstrations in Syria, he said that we have germs in Syria that we need to get rid of. In one of the interviews, he mentioned that if you are a surgeon and you have blood on your hands, that doesn't mean that you are criminal. In another interview, he said, he was asked whether he would be as brutal as his father, and he said, if you have a gangrenous leg in your body and you cut it, that means that you are trying to save the body, you're not a criminal or brutal. So he tends to use medical terminology, but of course...
All right, Dr. Sahlul, I appreciate it. I appreciate you joining me.